有一个问题就是有抑郁症、躁狂、焦虑症，很长时间找不到医生，每天很痛苦，我可以怎么样子帮助自己？怎样找到医生？这个的话，I don't want to put anybody on the spot， 就是说有没有我刚才就是suggest a number of things. First, starting with insurance company. Insurance company usually will tell you who's in network for you. 然后 insurance company 如果没有办法找到的话，可以我刚才 list 一系列像什么 Amwell、Teladoc 这些 online services 它都会有。Both psychiatrists and therapists, 你可以试一试。Even community mental health centers sometimes can get you in a little bit sooner. 至于说就是每天有抑郁和躁狂，这个的话，躁狂它I can't make a diagnosis of bipolar， 所以说我觉得第一步还是要诊断，就是有没有真的诊断下来。如果真的是有躁狂和抑郁的话，那就是双向，就是 bipolar depression、bipolar disorder。那这样的话，自助就是说 there are some things we can talk about, with self-help， 但是遇到这种情况还是需要用药的。With bipolar, medication actually is very necessary. 所以这个的话，第一步还是需要 diagnosis. What to say after they express their problems or concern? What can we say other than mentioning professional service? 这个问题我不是很懂。
我可以帮这个听众解释一下吗？因为他这个问题 post 出来的时候，就是当时正在王医生正在给我们显示那个 slide 上，就说我们可以说什么，就是说就说不要说那些 blame 的话呀，那些评判的话呀，而是要说那些就是说关心的话呀，理解的话那些。然后对他就说
我读了那些。
挺山后来，对，
所以他的问题就是说除了说了那些以后，那接下来我们又能说什么呢？
接下来又能说什么 ？OK， 那接下来的话，你可以就是 you can ask them what do you think? Are you willing? I mean, a lot of it depends on what this person's response is. Maybe what they need is 这个时候他可能是希望能进一步的，就是empathic listening， 你是不是希望我们继续谈一谈？你有没有更多的愿意跟我分享的？你可以问一问，或者说，那你这个时候你需要我做些什么吗？我怎样子来帮助你？Do we move into the action phase? Do you want me to actually help you look up professional services? I can do that. Or would it be helpful for me to listen more? Would it be helpful for us to go for a walk together? Are you having trouble maintaining, day-to-day life, like cooking for yourself? What can I do? Basically ask, what can I do? What would be helpful to you? I think a lot of this really depends on the dynamic and the moment. And the important thing is you ask questions and you try to get the other person to let you know what it is that they need in the moment.
就是那些我读了那些句子之后，也有可能是，如果对你的家人朋友他开始说了，你可能就好好听就行了吧？
对，
因为你说的目标是让他告诉你 what's going on， 就他们正在发生些什么，遇到一些什么样的困难。有人举手了。
对，王医生，非常谢谢您这么深入而且流畅的presentation， 真的很受益。我想请问一下，您有讲到过我们要 change thoughts， 对不对？如果说是一个医生让你等了一段时间，你会有不同的想法，会造成不同的情绪。那我们这是跟self doubt 有什么样的区别呢？就是说我们如果会 doubt 我们的 feeling， 然后 doubt 我们 feeling 的话，会让我们陷入一个一直在那种被 mistreated 的一种状态。我需要更清楚的解释一下吗？比如说那个医生
，Can you give me an example？ 对，给我一个 example。
可能那个医生根本就是对你不重视，对吧？我曾经有一次，一个医生一直说马上就来，结果让我等了1个半小时。这种情况是不应该出现的。对。后来那个医院刚好他的有一个 open house， 就是让我去就是让 clients 去发表意见，我就把这说了。说了之后，我就再发现我这个医生对我的态度好了一些。其实前段时间不仅是让我等了1个半小时，而且别的实验的态度，就是说，就是进来看也不看我，就是 How are you？但是给我感觉根本就不 care How are you？但是后来等我反应之后的话， 它有变化，知道吧？那在那种情况下是怎么样去是改变 thoughts 呢，还是 follow your intuition？因为我们如果说是改变 thoughts，像我是一个 people pleasing， 那我很多时候我都是在 doubt my feelings， 会 question 是不是我 make a big fuss of it，right？ 是不是不太考虑别人的感受呢？那这种情况下，我会一直陷入一个真正是一个受害者被他 mistreated 的那种情况下。那这个时候是怎么样区别一个真的就是我们需要改变 thoughts， 还是需要 trust our intuition, respect our feelings？
This is a really, really excellent point, because that's kind of part of CBT that can be a little bit frustrating, because sometimes so sometimes our thoughts and intuitions in this case are very accurate, right? Because indeed in this case the doctor was acting inappropriately, and you don't want to make yourself think, oh, it's my problem. I'm over analyzing and I'm overreacting. CBT isn't about making one thought more important than the other thought. It's about expanding the realm of possibilities. Now, in this case, we wouldn't say you're overreacting. There's all these other possibilities. Your possibility that the doctor is acting inappropriately is one of the many possible outcomes. And based on experience, that is the most, in this case, it's actually the most likely scenario, right? We talk about what are different scenarios, what's the most likely scenario, what's the best scenario, and what's the worst scenario. In this case, because of your past experience, right, that actually may be the most likely case scenario. So we say the most likely case scenario is also in this case, the worst case scenario, unfortunately. So if it is the worst case scenario, what do we do? Right? If we recognize that this doctor is kind of a sucky person, they don't respect us, how can we turn this into an effective problem-solving strategy? We can start to feel very angry. We can start to say, they're not valuing us. I feel really angry. I feel hurt. Those are all legitimate feelings. And part of CBT is it kind of always wants us to kind of change our thoughts. That's why I feel like it's also important to bring in DBT, because our feelings are valid in that moment. Based on your experience, that's probably what's happening. That doctor is not very conscientious of time management. So your thoughts and feelings are valid. But then we kind of move into kind of problem-solving standpoint. Let's say the worst case scenario is that he does not really respect my time. So what do? I have choices. I can go and make a complaint like you did. I can go and try to change the outcome. I can choose a different doctor, right? So we don't dwell on this, I feel valued, I feel worthless, I feel angry. It's okay to have those feelings, but we always also move on to problem solving. Even in the worst case scenario, this is a terrible doctor, is a doctor who doesn't respect people's time and space. In that case, I can still be okay. I don't have to stick to this doctor. Maybe I have some agency in change. Maybe this doctor is ineffective, not because he doesn't respect, but because he's not very good at managing time. Sometimes I run into that problem, not because I don't respect people's time, but I'm also a people pleaser. If somebody's really needing me, I kind of, go overboard, and I may extend that time, and then I run into other people's time. So maybe it's their ineffectiveness. Maybe if I complain, maybe if I say something, maybe it'll help them. So again, I don't want your feelings to be invalidated. If you know this is the most likely case scenario, trust that. If you know that that's what's happening, that's okay. But even in that scenario, even in the worst case scenario, that doesn't have to destroy your day. You move out of that kind of reactive, angry phase and go, if that's the case, it doesn't have to ruin me. It doesn't have to ruin my healthcare. I will do something about it. I will complain. I will talk to management, or I'll go find a different doctor. Does that make sense?
Yeah, very well. 谢谢你。那我在想，就是说，我们要经历，因为我就是很容易 self doubt 我的 feeling 嘛，那总觉得一次可能不算，对吧？我虽然 my gut feeling 是这个医生可能不一定很合适，但是 I try next time，try next time，是一直到等到最后爆的不行的时候，I'm down。但是就是我们要 trust 怎么样？要试几次呢？有人就是中国有句话就事不过三，对吧？那我们要试几次才会觉得 ，Yeah, my gut feeling is right。而且不是说一开始就 make big fuss of it，但是呢，也不是说是一直让自己 tolerate the situation 一直到爆。
Right, exactly.
就是要到一个什么样的程度
So I think maybe we start with, you're talking about two extremes. 一个就是一直忍耐，一个就是爆发，对不对？ In between that, maybe there's room to kind of have open dialogue, to maybe bring this up to the doctor in a friendly but serious way. And that's actually, the interpersonal affective piece of DBT. How do we advocate for ourselves so that we don't wait until we are explosive? How do we engage in a conversation so that we know that we have some needs that are unmet, so maybe before you get to the explosive stage, before you get there, you can say, maybe I'm wrong, maybe I'm right. Let me find out, let me communicate, let me talk to this doctor, see if I can open up that channel of communication. Then I will have more evidence to say, are they really just dismissive of me as a person? Are they really disrespectful? Or maybe is there room for them to understand where I'm coming from? Right? So we don't have to either repress or explode. The idea is that we find ways to kind of find evidence either way and kind of keep that communication channel open. But I think a bigger issue that you're saying here is that you have a tendency to doubt yourself and you have a tendency to not say what's on your mind because you don't want to offend the other people and you don't want to make a big deal out of things. That's a deeper issue. And I think that that's where maybe we need to engage in a bit more of a psychodynamic kind of understanding why you form this tendency, what your experiences as a child, what kind of experiences. Right, like we need to maybe do a bit more digging in that area. And then if you realize, okay, these experiences, these dynamics make me always doubt myself. Maybe I've had really invalidating parents, or I'm not saying that's the case, but maybe then you have that insight. Then it becomes a skills thing. So every day you need to practice. Okay, I realize I'm doubting myself, so I need to choose to have some faith in what I'm thinking. And I need to realize I can advocate myself without destroying the other person. I can advocate myself without making the other person feel completely angry. And the way you do that is by practice. You make it a point to always speak up and finding ways to communicate in a way that, is not until you're explosive. And that, that just takes practice.
太棒了，谢谢。
Thank you for sharing.
Oh, thank you so much.
王医生，我想替那个chatting room 里的朋友们问一个问题，这个问题被 repeated 问，就是青少年的这个网瘾和拖延期，拖延症，他们的背后有什么心理的原因吗？就是 generally 可以说一下，我知道你的时间快 run out 了。
I can. It's a good topic. I can talk about it in generality. So addiction, online addiction, and procrastination, right? So there could be various things underlying these behaviors, and it really depends on the individual. But what I see a lot of times is avoidance and escapism. So in my patients, a lot of times they procrastinate because they're unable to face the challenges that delving into something would present. They're afraid of failure. Maybe they're a perfectionist. They're afraid if I do it, it's not going to be good enough. So instead of delving into it, I'm just going to avoid it. I'm just going to pretend it's not there. I'm just going to wait until it becomes really, really impossible to engage. And then you procrastinate even more. With online addiction, similarly, I mean, it's not always about avoidance because, it depends on what they're using online activities for. It may be that that's their way of getting social interactions. Maybe in real life, they have difficulty communicating with people, but in, an online forum, it helps them open up. So there may be other things involved. But a lot of times I also do see that people scroll social media because that's their way of avoiding the pain of what's going on in their present. Like if somebody has a big presentation that they have to do, if they have a difficult kind of interview that's coming up, if they think about it, it makes them anxious. So they distract themselves. And social media is so pervasive. It's so easy to just scroll through. And before you realize that a lot of time has gone by, and then you're even further behind. So, that oftentimes is an avoidance strategy as well. But sometimes because you do something so much, especially with some online games, there may be a real element of addiction, because your dopamine system is all kind of whacked up at this point. So it may also become in itself kind of an addictive process apart from avoidance and all of that. So it's complicated. And I think the starting point is having a conversation with a child to understand what purpose is this serving? Are they using this to distract themselves from some sort of emotional pain? Are they using this because this is the only way that they can feel connected to somebody? Is there a real element of addiction? So these are all questions that we have to start asking.
谢谢王医生。你觉得网瘾会 trigger depression 吗？他们会 feed each other 吗？ Okay.
Yes, I think so. Yes. Depression can cause people to be more susceptible to addiction, not just like internet addiction, other types of addiction as well, and vice versa. But sometimes we call things addiction when it's really not addiction. This is, I'll use this example. So some people watch porn and kids watch, some kids, it's okay that people have natural kind of needs and they may watch porn and they may feel very guilty about it. And because of that guilt, they think that anytime they do it, it's an addiction, or they can't stop thinking about it because they live in an environment where people don't talk about sex openly. So they have to do it in secret. And then they're thinking about the next time they can watch something. And people may perceive that as addiction when it's actually not addiction. So we have to first understand, is it really addictive? Are they really addicted?
谢谢王医生。
我看到有3个举手的，不过有一个问题我先问一下，就是有的朋友问说，对高功能自闭 Asperger 的孩子 CBT、DBT 有用吗？
So this is an area where I think part of it depends on how high functioning this child is, how much they're able to engage in this kind of therapy. So, high functioning also has a range. And this is an area where, admittedly, I don't have enough training. I feel like, this is where maybe as a developmental psychologist, they actually would have more training and more expertise in specifically working and doing therapy with, people on the autism spectrum. So I have some patients that I work with that are very, very high, extremely high functioning, like, professor level, or, doctors who are actually on the spectrum. And for them, CBT works just fine, but they're extremely high functioning. They're able to compensate, they're able to engage, but not all high functioning are at that level. So it depends on the individual. But I think this is also a case where I might actually refer the patient out to somebody that have more training than I do with regard to autism.
下一个举手的。
好，我想问一下，就是那个网瘾的问题吧，就是说刚才讨论到这个网瘾引起抑郁症，但是呢，我也是看了一些书吧，就是这个网瘾呢，其实就对有抑郁症的孩子，就是说特别是对那个大学生的话，有很大的压力，特别是在 top score 的或者 medical score 的学生的话，实际上我觉得那个游戏可能也是帮助他们，就是说 reduce 那个
yes，
就是说
it may be a coping mechanism. You're right. Yes.
对，所以就是说现在就是说，我觉得就是 force 他那个完全戒掉网瘾的话，是不是一个 rejection 的话，就对孩子的话更大的压力，因为抑郁最害怕 rejection。
That's a very good point. Even though I think any sort of addiction can worsen depression, the way we treat addiction also is not abrupt discontinuation. Whether it's internet addiction or addiction to alcohol or addiction to opioids, we don't abruptly stop it because that can be extremely difficult to tolerate. There's a process of gradual taper, right? And also to your point, because it serves a purpose, it's their coping mechanism. So on the one hand, we don't want them to be addicted. We want them to fully participate. On the other hand, we also want to replace, if we're taking that away, we have to find something else that we can replace that with. So we can't just focus on forcing them to stop this behavior. We need to think about, what is this behavior serving? It's serving a purpose. So can we find something else to replace it? And as we gradually cut down, we have to recognize it needs to be also a gradual process. It's not just from up here to all of a sudden nothing, because that can be very, very difficult as well. And it can cause more emotional dysregulation.
还有一个第二个问题就是我自己吧，实际上我小时候就是很自闭的一个人，就是说，然后就引起自闭呢，就跟人交往就引起这个特别的自卑，就是 low self esteem。所以呢，就是说，然后呢，我觉得成人之后呢，就有一些事情呢，就是我觉得也是个抑郁引起，就是说犯了一些错误。现在呢，就是我们这个州呢，全都是 white，over 那个90% 是 white people， 就是很大的那个就是那个 discrimination， 就是在 work 里 discrimination 很厉害，所以呢，而且就是说，而且也很难找到一个说中文的医生，所以我就想自己帮助自己的话，最好的方法是看哪一些书。 或者是看哪些心理的医书，或者是怎么样的。
Yes, yeah. So once I publish the slides on the last page, there will be quite a few resources. There's a lot of podcasts, even for CBT and DBT, there are different types of podcasts. I listed them there. They are, you can, if you're interested in DBT, right? There's a book called DBT for Dummies, and it's written actually by one of my McLean supervisors who is really an expert in DBT, called DBT for Dummies. That may be a very good book if you just want to kind of really delve into methods of DBT. Another book that I actually think it's not really psychological. It's not, written by a mental health expert, but 7 Habits of Highly Successful People, written by Stephen Covey. It's very accessible, and it takes you through kind of a value system that helps you approach life in a more holistic way. I feel like for people that don't necessarily just want to think about, psychological kind of disorders, but you want to think about how to establish wellness, how to live meaningfully and fulfilled. 7 Habits may be a very good book as well. But I'm going to make a list of resources available on my last slide, and you can go take a look at that at the end of the presentation.
好，谢谢你啊，好，我没有问题了。
王医生你好，因为chat里我看有很多人问问题啊。我觉得有一个问题可能对很多人都有共性，就是说他说有这个孩子已经大了，上大学了或者工作了，然后他发现他自己有这个精神心理方面的需要，他也去找这个help 了，就 therapy 了。那么家长呢也想要跟他搞好关系，帮助他，但是他就不理家长，那家长就很苦恼，他就问他说那我现在应该是继续 try to reach out to the child 呢，还是说我就应该就是尊重这个 boundary， 他不愿意理我，我就不要去理他了。因为孩子说的是家长想要控制孩子，但是家长实际上想关心孩子。
对。That's a really good question and a very common situation actually I see in clinic. So do we leave them alone or do we continue to try to reach out? I think this is where dialectics come in. We do both, okay? So I don't think we should completely just leave them alone, but we should respect boundaries. A lot of times when kids say, I don't want to talk to you anymore, they don't mean I don't want you in my life. They mean I want you to respect my boundaries. If you talk to me, you have to talk to me in a way that I can accept. A lot of times parents talk in a way that is indeed controlling, maybe not this particular instance, but maybe there's a history of them talking to kids in a way that's controlling, that makes the kid actually feel a little bit traumatized. And whether or not the parent has that intention, there's that history there. So it's hard to kind of break through that. How do you break through that? You have to prove to the child that you can respect their boundaries. So ask them what is okay, what is not okay. If the child says completely be out of my life, well, I can't do that. You're my child. I love you. I want to stay in your life, but I don't want to control your life. I just want to be a part of it. Find ways that they can accept and respect their boundaries at the time. You don't just leave them alone, but also you do need to respect their boundaries. Now, if you worry about safety, if they're about to commit suicide, if there are these concerns, then yes, you have to breach that boundary. But short of that, if they want you to not keep asking questions, for now, you say, okay, I'm going to listen to you. I'm going to respect that. I won't ask those questions, but maybe we can talk about something else. Maybe we can take a walk together. There are different ways to connect.
那我再问下一个吧，我觉得也是chat里头的这个问题，我觉得也比较 general， 就是如果你身边的人，你觉得他确实是有狂躁啊，或者是抑郁啊，或者是怎么样，你觉得他很需要看医生，但是他自己就不承认，然后他就不愿意去看医生，你怎么样能够帮助他，让他认识到这一点？
It's very challenging. Ultimately, it comes down to your connection. 你和这个人之间的 connection. Do they have that trust in you? 如果比方说他真的是到有躁狂到一定的severity， 那这个时候他是没有 insight。不管你怎么说也没有用，真正的。When they get to that point of, real mania, 那你说什么也没有用. So there may not be very much that you can do. But if they're acting in an unsafe way, 如果他们的躁狂导致他们做出一些就是过火的行为，让他们有安全方面的问题的话，那这个时候不管他愿意不愿意，你都可以叫救护车来，你都可以拉他去医院。他可能会很憎恨你 ，but that's the right thing to do. 不管是躁狂还是 depression， 如果说这个人有人身安全了，那不管他愿意不愿意，你要把他送去医院，你要打电话给911或者给医院。But if they're not at that level and they really, really refuse, there's honestly, there's nothing you can do. Like there's nothing I can do either. If somebody comes to me, but they refuse to do anything, you know, even if they're in my office, I can't force them to do anything. So people have to be willing to accept help. Now there's a little bit of room where if they are very connected, if they really trust you, and if you're not too pushy, maybe you can establish that connection. And then over time, very gradually, you can help to increase their awareness. You can show that you care, you can be with them, you can hear them. And then maybe over time, they will be more willing to listen to you. But sometimes there's nothing we can do, and we can't take it all upon ourselves either.
谢谢王医生啊，这里还有一个问题就是有人在问有没有emotional 和 physical abuse supporting group for Asian women 在Eastern United States?
I have to look into that. I am not. I mean, these kinds of support groups exist a lot, but I don't specifically for Asian women. I'm not sure. I can talk to my colleagues at Mass General where they do a lot of cross-cultural work and see. I'm not aware of any specific just Asian women support groups. Maybe
对，我知道有那种 abuse 的for women for generally women 的 shelter 是吧？但是没有说。对
specific ethnicity 这个好像我不知道 but I mean I can look into it, I can ask.
也许去那个 shelter 他可以找到那个 translator, I'm not sure. 对
Yeah.
另外一个 question 就是对这种 teenager 在青少年的时候，你觉得是因为荷尔蒙的缘故他们会 act 对父母比较 rude 和disrespectful 吗？还是这是正常的吗
？Yes and yes. I mean, because of hormones, they may act, you know, like they may act like they're pathological. They're very impulsive. They can get angry easily. They can be agitated. It's hormones and it's to be expected. It's also developmental.
So where is the boundary? 父母应该说，这个是 cross the boundary. You have to be disciplined, or we should understand and 知道这是一个 very difficult stage for them.
I mean, I think that depends on open communication. I mean, there's some boundaries. It depends on the family, but there's some boundaries that you cannot cross, right? You can't punch, you can't get physical. My kids are still young, but still have these boundaries. You can't, you know, sometimes they can't help themselves, but still that's a boundary. You can't punch, you can't hurt somebody physically. You can't intentionally hurt somebody. You can lose your temper, you can yell, but you need to somehow come back and have another dialogue about it afterwards. You know, I think this comes down to family value. This comes down to what's acceptable to your particular family. But I think if there's any safety issues involved, then that's a clear boundary.
还有很多人想知道怎么联系你，你收不收这个 medical insurance?
Yeah, so I apologize. I don't take medical insurance. My clinic is actually full at this point. So like I said, you know, there's a wait list, and you can go to my website, buckspsychiatry.org. But like I said, right now I'm full. I do have a wait list, and if you're able to wait a couple months, you know, I may be able to see you, but it's not right now.
谢谢王医生。下面 Alan 要问一个问题。
对王医生，谢谢哈。我想问一个问题，就是比方说对于这些高中生孩子的这些家长嘛，就是以前他们也发现他会有一些问题，但是呢，一直孩子也不同意去见医生见 therapist 那些。那是如果真的发生了一些什么情况，什么情况下其实可以请这个介入，就是说，就给他把他送到 emergency， 这样的话呢，他就被迫就要去看医生了。这样就会有一些资源给他，是什么样的情况可以做呢？
Good question. So for especially for high school students, right? So if there is any kind of suicidal ideation, if you discover that they're making threats that I don't want to live, you know, I'm going to hurt myself, I'm going to hurt somebody else. If they're making safety threats against themselves or against somebody else, you document it. You call and you get them into care, whether or not they want to go. So safety is one big thing. The other big thing is if they constantly miss school, if because of their mental health issues, they are, you know, there's a lot of truancy, they're not able to go to school, their grades are completely falling apart. At that point, even if you don't, the school system may actually get them into care because that's another sign that they're not doing well. Let's see what else. If they're not taking care, like if they're not eating, if they're not taking care of personal hygiene. Sometimes kids can be sloppy, but if there's a huge change from baseline in terms of how they operate day to day, if they're losing weight, not eating, if they're not showering for a week at a time, if they're never leaving their room, they're just isolated in their rooms, these are all symptoms that you can actually say, well, that's severe enough that an intervention needs to be made.
谢谢王医生。那还有一个就是我想问一下，就是什么样的情况就是去到医院之后，他们会给他转接到精神病院？
如果这些症状是 because of psychiatric issues， 你说转到精神病院，就是说如果他先去一个 general hospital， 然后把他转到一个 psychiatric hospital， 是这个原因吗？
对，
okay.
因为我是做翻译的，有时候工作之中的话，我会遇到这样的情况，我就看到有些孩子呢，他们是被送到精神病院，然后在那里待了一段时间，最后是需要医生同意他才可以出院的，平时只能是妈妈过来看他，或者1-2个小时带他回家那样子的。
对，就什么情况下他如果去了一般的 general hospital， 然后会被转 admit 到 psychiatric hospital， 那 it depends on the reasons that the child is brought into the hospital, right? So if the child is brought into the hospital because they're refusing to go to school, and in the process of interviewing whoever the doctor is in the hospital, when they interview the child in the emergency room, if they have any concern that the child is really depressed and these symptoms are a result of depression or anxiety or any other psychiatric illness, then they will send the kid to a psychiatric hospital. It depends on what the reason is for them to go to the emergency room in the first place. A lot of times kids may be brought in because, they have erratic behavior, or maybe they're not eating, they're worried about dehydration. But once they're in the hospital, they realize the root cause for these things is actually because they're very depressed or because they're psychotic, then they get sent to the psychiatric hospital instead. Sometimes to get into a psychiatric hospital, you have to go through the emergency room to have medical clearance to make sure that there's no other medical reasons that the kid is behaving this way. So you may still have to go and get, all these physical workups done, which is a good thing, and then go to the psychiatric hospital.
好的，谢谢医生。
Maybe do one last question, yeah.
Okay.Thank you, 王医生。就是刚才您讲座的时候，您提到有很多人他会使用 life coach， 不管是 parenting coaching 还是自己的 life coach。那我们找这样的人的话，这些人需要 certificate 吗？还是他们就可以自己 self claim as a life coach？
This is a hard one because I'm not familiar with exactly how certification of this coaching thing is done, and it's very vague. It's kind of vague for me. 我觉得如果你要找 coach 的话, I think you should look for somebody with certification. Now, I'm not familiar with that whole process, but some people may claim to be a coach and they may not have had the right training. So just as if you look for a doctor, you want to make sure that they actually have a medical license. I think you should look for somebody with real credentials.
Okay,
但是具体怎么样子 confirm, I'm honestly not too sure about coaches.
Okay, thank you. 我就是觉得其实这个话题我知道，就像很多人，你看咱们现在在身体方面的管理，就是说如果哪怕身体感觉很健康，也会每年去做年检也会去找一个健身教练，就是为了更健康嘛。但其实精神方面，我觉得是更需要的。哪怕你觉得我是个正常人，也是要找 coach， 就是要更健康，心理健康更健康的那种，
更上一层楼。
对，就是其实跟照顾身体是一样的，我觉得。
That's a very good point. That's a very good point. Whether that's through a coach or a support group, sometimes even just having a group of friends that you periodically check in with each other. 如果其他方面你 everything is very good, even sometimes just having that like meeting with friends periodically may actually be a way to check in as well.
Okay, thank you, 王医生。